Professor Butler here. Wanted to do a review of what I like to call our cardiovascular lazy river, a refresher of the anatomy and physiology of the cardiovascular system, as well as talk a little bit about heart failure. Okay, so let's start talking about what I like to call the cardiovascular lazy river. Right, it's imperative that you understand how blood flows through the cardiovascular system. Okay, so let's start on talking about the two different sides of the cardiovascular system. We've got the arterial side, which is the high pressure side, the oxygenated high pressure side. We have got the venous side, which is your low pressure deoxygenated side. Okay, so when we think about how blood comes from our feet all the way back up to our heart, how does that happen? Right? Think about this. We know that there are one-way valves, but how does blood travel against gravity? How blood travels against gravity is through compression, right? That's why when we tell patients, or when we go on a long flight, you're told that you need to get up and move your legs. Reason being, when you're not contracting your muscles, the blood is allowed to pool. What's our biggest concern when blood pools? Create a clot, right? If that happens, we would have what's called a deep vein thrombosis, or a clot that happens in the venous side that travels from the legs up into the heart itself, causing potentially a pulmonary embolism, which we absolutely do not want to happen, right? When it comes to healthcare settings, when our patients can't contract their muscles on their own, that's when we put them in something like SCDs, sequential compression devices. So in procedural areas, in ICUs, any place that a patient is not able to ambulate and to contract their own muscles, we're going to put SCDs on to make sure that they don't have any pooling blood. Okay, so first thing is that contraction is what gets the muscle contraction is what gets blood coming out back to the heart. Okay, so let's talk about this. So what are the two blood vessels that blood comes back to the heart? Okay, we have got our superior vena cava and our inferior vena cava, right? Mind you, this is coming from the venous side, so we are on that low pressure deoxygenated blood. Okay, so that's going to come into your first chamber of the heart. As you're thinking about this, 4 chambers, 4 valves. Okay, so the first chamber that we are going to go into is going to be called the right atrium. Okay, so that is our very first chamber that blood is going to travel through. Our first valve is the tricuspid. Okay, tricuspid. We've got a tricuspid and we've got a bicuspid. The easiest way to remember that. Okay, so thinking about where blood starts, think about your patient's always right, so you start on the patient's right side of the heart. We try before we bi. Okay, so tricuspid is on that right side. Okay, through that tricuspid valve, we then get to the right ventricle. Okay, that is our second chamber that blood is going to be traveling through what I like to call the cardiovascular lazy river. On the right side of the heart, we are deoxygenated blood. Okay, the second valve that blood is going to travel through is going to be our pulmonary or pulmonic valve. So the right ventricle, as it contracts, is going to push blood to the lungs. As it is going to the lungs, the way that blood travels from the heart to the lungs is in our pulmonary artery. Thing that's very unique about arteries, normally they carry oxygenated blood, but in this case, it is carrying deoxygenated from the pulmonary artery into the lungs. There, gas exchange happens. O2 is picked up, CO2 is dropped off to be expelled. How does blood from the lungs get back into the heart? Coming from the pulmonary vein. As we know, the venous side is normally low pressure. It is also deoxygenated, but in this case, the pulmonary vein carries oxygenated blood. Then we get to our third chamber. Third chamber is our left atria. Okay? Then we get to our third valve. The third valve, we've already tried before bicuspid or mitral valve. Okay? And the fourth chamber that blood is going to travel through is going to be our left ventricle. Okay? That's the fourth chamber. On the left side of the heart, we are now oxygenated blood. The last valve that blood is going to travel through is going to be our aortic valve. Okay? So aortic valve is then going to take blood to the aorta, which is then going to take blood and potentially go to the body. Make sure that you understand this lazy river when it comes to the cardiovascular system, right? Right side we are deoxygenated, left side we are oxygenated. Make sure that you know what chambers that blood travels through in which order, as well as the valves, okay? So you got to start with this to understand heart failure, okay? So now let's talk a little bit about how heart failure works, okay? Easiest way to understand heart failure is to, first of all, you have to understand the cardiovascular lazy river. From that point, think about that your patient is having a dam in that part of their heart, okay? For whatever reason. So say, for instance, your patient has right congestive heart failure for whatever reason, for something like potentially anything involving possibly the lungs can lead to right congestive heart failure. Any problems with tricuspid or the pulmonic valve can lead to right congestive heart failure. Okay, so anything that makes that right side of the heart work harder. So think about what valves are all involved in that. Okay, but when it comes to right congestive heart failure, think about a dam. When it comes to a dam, is water higher before the dam or after the dam? Normally, it's higher before the dam. Okay, so if your patient has right congestive heart failure, where is blood just prior to coming to the right side of the heart? It is in the body. So guess where you're going to see the manifestations of right congestive heart failure? It is going to be in the body, right? You're going to see edema, jugular vein distension, ascites. Those are all going to be the manifestations of right congestive heart failure, okay? Now let's look at left congestive heart failure. So think of all the things that would make the left side of the heart work harder, right? Having some type of bicuspid valve or mitral valve regurgitation. Our aortic valve is there, aortic valve stenosis. All those can lead to left congestive heart failure. If that left side of the heart has to work harder, right? So if by chance your patient has hypertension, that can lead to left congestive heart failure, okay? If your patient has coronary artery disease, because our coronary arteries come off of this aorta itself, coronary artery disease would make that left side of the heart work harder. So along those lines, if your patient was building a dam on the left side of the heart, where is blood just prior to coming to the left side of the heart? It is in the lungs. So guess where you're going to see manifestations of left congestive heart failure? You're going to see crackles in the lungs, okay? So as you can see here, depending on what your patient has, so they can have right congestive heart failure, left congestive heart failure, or they can have what's called biventricular, right? And a lot of times when you see a patient's comorbidities, their medical diagnosis, you'll just see heart failure. But how do you as a nurse know whether it's right congestive, left congestive, or biventricular? A lot of times it's going to be based upon your assessments. So if you see that your patient has pitting edema, they've got jugular vein distension, right? They've got ascites as well as crackles in the lungs. They have biventricular, okay? Now, a patient, as I just said, with right congestive heart failure, there are times that a patient can build a dam somewhere in this cardiovascular lazy river on their own. For instance, patients that are smokers, right? Or patients that have COPD. Patient has COPD, right? Because of potentially smoking. So COPD, that patient is building a dam in their lungs. Where's blood just prior to coming to the lungs? It is on the right side of the heart. So when patients that have lung issues potentially can lead to right congestive heart failure. Hopefully with a review of the cardiovascular lazy river and understanding that when you are talking about heart failure, think about building a dam in that portion of your patient's cardiovascular lazy river. Where is blood just prior to that? That is where you're going to see the manifestations of that heart failure. I hope that this video helped you just a little bit with a review of the cardiovascular lazy river, understanding left and right congestive heart failure, even understanding biventricular. And just remember, guys, you can do anything you set your mind to. You just have to believe that you can, right? You can do anything. Because again, remember, find your zone of genius because everyone has one. I hope you enjoyed this video. It gave you a little bit more insight, and happy studying. Here's to all the beautiful future nurses.